For most of us, springtime means sunshine, green grass, and blooming flowers. But for some of us, it can mean sneezing and watery eyes, or even trouble breathing. I'm talking about allergies, and almost anything can cause them. Grass, flowers, ragweed, peanuts, bee stings, penicillin, soy, latex. The list goes on and on. An estimated 40% of the world's population suffers from allergies, and that number is on the rise. But how can a peanut so small and simple and delicious be so deadly? And what are allergies anyways? How are they caused? Can they be prevented or even cured? Well, to understand allergies, we must first talk about your immune system. Your immune system is meant to keep you healthy, but in people with allergies, they tend to overreact. And you can lay the blame on your lymphocytes, or white blood cells. Lymphocytes are like little hall monitors traveling around your body on the lookout for antigens, which are foreign invaders like parasites, bacteria, and viruses. When a lymphocyte detects an allergen, it begins producing large Y-shaped proteins called antibodies. Humans have almost 10 billion different kinds of antibodies, and each one binds to a specific antigen, neutralizing the threat. It's like having the keys to 10 billion different locks, but in an allergic person's immune system, the lymphocytes get confused. They treat allergens like they're antigens. Allergens in cells are really just a kind of enzyme called an antigenic protein. Scientists don't know what it is about the structure of these proteins that cause such an alarm in some people's immune system. They don't resemble viruses or bacteria, but the immune system still treats them like a threat. But doctors do know, while thousands of substances can be allergens, some are much more likely to send your immune system into overdrive. That's why just 8 foods account for 90% of all food allergies. Tree nuts, eggs, soy, peanuts, fish, milk, and wheat. When someone's first exposed to an allergen, their lymphocytes create a bunch of antibodies called immunoglobulin E, or IgE. Everyone has IgEs, and when they attach to the surface of certain immune cells, these cells then release enzymes that help fight infections. It's all part of a defense system that evolved to protect us from parasitic worms and bacteria. It's pretty effective, at least when it's working properly. But when an allergic person's lymphocytes are faced with an allergen, their immune system freaks out and overproduces these enzymes, causing the symptoms of allergic reactions. These include runny noses, itching, or hives. More severe reactions can involve nausea, vomiting, or even trouble breathing. The severity of these reactions is dictated by a wide variety of factors, like how much of an allergen is in the body and how concentrated the immune cells are that have IgEs bound to them, and how much of the enzymes they're producing. In some people, the histamine enzyme can be the problem. Histamine dilates blood vessels and increases mucus production, allowing for infection-fighting cells to travel to the affected area. Too much of it can cause itching or a runny nose, but immune cells in other people might release a lot of an enzyme which is called tryptase, which is linked to the absolute worst reaction you can have, anaphylactic shock. An overload of histamine and tryptase can cause your blood pressure to plummet. Then the bronchial tubes constrict, making it harder to breathe, and in some cases, the throat can swell too, cutting the oxygen supply completely. Hundreds of people in the US die every year from anaphylactic shock, which is why those who have severe allergies usually carry around an epinephrine shot, just in case. Epinephrine is a form of adrenaline. When it's injected, it constricts the blood vessels and eases swelling, allowing the sufferer to hopefully breathe again. The effects only last for about 20 minutes though, so the person will usually get themselves to a doctor. That's how allergies work. But why do we have allergies in the first place? I mean, how does it make sense that something totally harmless to one person can be lethal to another? Well, it doesn't make any sense, at least not yet. Scientists can't quite agree why we have allergies, but they do know that allergies have genetic components. Studies have shown that you suffer from allergies. If you suffer from allergies, there's a 33% chance that your kid will develop allergies as well. And if both parents have allergies, the risk jumps to 70%. But it's not that the child inherits specific allergies. They just are more likely to develop them. So a parent who's an allergic to eggs could have a kid who isn't allergic to eggs, but is allergic to peanuts. Kids can outgrow their allergies, though. And the extra IgEs that their bodies produce are at the highest level before age 10, but they drop drastically by the time they reach 30. So if someone has an allergy to one antigenic protein, there's a good chance that they're allergic to other proteins as well. That's called cross-reactivity. So if you're allergic to ragweed pollen, you're more likely to be allergic to apples because the protein structure in both are very similar. That's why the immune system treats them as the same antigen. Why certain people develop allergies isn't the only thing puzzling scientists though. Allergies around the world have been rising since the 1980s. Reports of food allergies among children in the US, for example, increased by 20% from 1997 to 2007. Some scientists suggest that the air pollution might be to blame. 3 studies in the early 1990s linked pollutants like sulfur dioxide and carbon monoxide to allergic asthma. In one series of studies, researchers found lower instances of allergies among children in what was then East Germany, compared to those who grew up in the more developed West Germany. Even though the kids in East Germany were exposed to a lot more air pollution than those living in the West, scientists concluded that Western pollution contained more carbon monoxide from automobile exhaust. But there are other theories too, like the idea first developed in 1989, known as the microbial deprivation. This model essentially suggests that the modern industrialized world is just too darn clean. We know that allergies are highest among those who lived in wealthy developed countries and in urban areas, regardless of race or sex. According to microbial deprivation, children who grow up in these environments simply aren't subject to enough dirt, grime, bacteria, or parasites, depriving them of what scientists call benign exposure. The hypothesis suggests that this benign exposure helps balance the immune system, giving it something to fight. Maybe when there aren't enough pathogens to keep it busy, it overreacts and attacks harmless things like pollen instead. There's some research to back this up too. In 1998, one study suggests that children who went to daycare and thus were exposed to a lot more viruses had lower instances of allergies than those who didn't go to daycare. And in 1999, a Swedish scientist noted that farmers' children who had regular contact with animals before the age of 7 and drank unpasteurized milk didn't develop as many allergies as children who lived in the city. Now, these scientists aren't suggesting we return to the days of drinking dirty water, because a lot of those parasites and bacteria, like dysentery, killed people. 200 years of sanitation have brought a lot of good things to the world, but researchers are noticing a correlation between an environment devoid of microbes and an increase of allergies. This link has led to an experimental form of treatment called helminth therapy. Helminths are parasitic worms like hookworms that people deliberately infest themselves with in order to ease their allergies. Sounds kind of gross, right? But recently, studies are showing that it might actually work. For instance, a study in 2012 found that patients infected with worms needed less medication than those who were worm-free. The downside is, those worms also gave patients stomach aches, bad gas, and diarrhea. Yeah, I mean, parasitic worms will do that to you. Thankfully, there are ways around allergies that are slightly less horrifying. For example, in many cases, we actually know the antigenic proteins causing the reactions, so we get around them. Like when it comes to eggs, we know that they have 4 different antigenic proteins in the whites alone, plus 3 more in the yolk. meaning that someone whose immune system reacts to the antigenic protein in the white could be perfectly fine to eating the yolk. And some of these proteins, specifically those in eggs and milk, can be destroyed by extensive and prolonged heat. One study showed that only 4% of children with an egg allergy reacted to a muffin after it was cooked for 30 minutes at 175 degrees Celsius. Heating the proteins has changed them enough that they weren't triggers anymore. And then there are more traditional forms of allergy treatments like immunotherapy, which works by changing the way your body responds to the allergens. Once or twice a week, over the course of a year, a patient is injected with a tiny dose of an allergen. Because the exposure is low and so constant, the immune system gradually stops responding with IgE antibodies. Instead, it begins responding with IgG antibodies, another more common type of antibody that fights chronic infections. These IgGs don't bind with the immune cells first, so they don't release histamines or other chemicals that cause allergic reactions. Instead, they bind to an antigen and neutralize it directly. The downside of these shots is that they're really expensive and time-consuming, and they don't work on severe allergies, which can be triggered by even those small doses. To treat more severe allergies, researchers are looking into anti-IgE immunotherapy, which directly blocks the production of IgE and just takes the whole thing out of the equation. In this kind of treatment, patients are given the shot of a drug called omalizumab, which binds to the existing IgEs in the blood, rendering them useless. It also blocks future production of the antibody by binding to the lymphocytes that make it. But then guess what? Some people, although really few, are allergic to this shot. So the safest option, at least for people with food allergies, is an avoidance diet, which is the official name for what people, the rest of us, would call common sense. Just don't eat what you're allergic to. So if you're allergic to shellfish, don't eat lobsters. Problem solved.